We'll now move on to oral questions put by members to ministers. The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. Many Nova Scotians will remember two famous or infamous pledges made by this government. One was a doctor for every Nova Scotian, and the other one was that this government would be the most open and transparent government in history. Well, Mr. Speaker, there's no hiding that the fact that neither of these pledges has been delivered on. We have a crisis in our healthcare system. And I'd like to ask the Premier, who is the person that is ultimately responsible for making sure Nova Scotians have access to health care in this province?
The Honourable Premier.
Thank you, Mr. Speaker. First of all, I want to congratulate the Leader of the Conservative Party on his first question period and accepting the challenge of leading his party. And I wish him well, but not really well. And I want to acknowledge his wife who was here. This is definitely a family journey, and this is a special day for them, so I'm happy that they are here, and I will try to treat him nice while she is in our presence. And I hope he does the same. Mr. Speaker, but to answer his question, Mr. Speaker, we're very proud of the work that has been happening by all members of our team, whether it's in the Health Authority, Mr. Speaker, or in the Department of Health. We've seen an increase of family physicians coming into our province. Last year we had an increase of 56. We had specialists coming in. We're excited about the redevelopment of our, not only here in HRM, but the redevelopment that's happening in Cape Breton Island. We're excited about that new infrastructure, Mr. Speaker. Healthcare professionals are excited about that infrastructure, and we're going to continue to work with our partners to ensure that we deliver the top quality health care that Nova Scotians expect.
The Honourable Leader of the Official Opposition on his first supplementary.
Thank you, Mr. Speaker. And if that answer was on the board of Family Feud, it might be on there somewhere, but it wouldn't be at the top, Mr. Speaker. The person that is responsible for making sure there's access to health care in this province is the Premier. That's the answer to the question. And when you look at what's happening in this province with 50,000 Nova Scotians without access to primary care, paramedics at their wits' end, somebody has to stand up and accept responsibility for the issue. So I'd ask the Premier again, a second time, who is ultimately responsible to make sure that Nova Scotians have access to health care in this province?
The Honourable Premier.
Speaker, I want to thank the Honourable for the question. The last time he stood in this House, Mr. Speaker, he said there were 100,000 Nova Scotians without access to a family physician, Mr. Speaker. Today, he said there are 50,000. That is a marked difference, Mr. Speaker. What an improvement, Mr. Speaker, in a short period of time. So again, Mr. Speaker, I want to thank all of our partners who are out there finding solutions to ensure that we provide primary care in all of our communities and access for all of our families, Mr. Speaker, and we will continue to work hard to make sure that more and more Nova Scotians have access to primary health care across our province.
The Honourable Leader of the Official Opposition on his final supplementary.
Mr. Speaker, the Premier asked me to be kind, so I cut the number in half. There are tens of thousands of Nova Scotians without access to a family doctor, and we have good people working in the healthcare system. There is no question, but we need political leadership. And I can certainly sympathize with the Premier not wanting to take responsibility for the mess that is healthcare in this province right now. But I suggest to him that the only way forward is for somebody to actually take responsibility for trying to fix the problem. And I would urge the Premier to be that person. So I'd ask the Premier, will he take responsibility for healthcare in this province?
The Honourable Premier.
Not only will we take, Mr. Speaker, the issue of providing primary health care to Nova Scotians as a top priority for them, it is for our government. We continue to see substantial improvement, Mr. Speaker. The Honourable Member already recognized the number that he'd been using in previous sessions has been decreased by half, Mr. Speaker. As he began his supplement to the third question, Mr. Speaker, it's tens of thousands, so the number is going each time he stands up. So we're absolutely thrilled about that. But the reality is, Mr. Speaker, we have responsibility to make sure that we continue to grow the economy, provide the services that Nova Scotians expect in health care and education, vulnerable citizens are looked after, Mr. Speaker, population growth. All of the indicators in this province, Mr. Speaker, are leading in the country, Mr. Speaker. We're thrilled by what's happening. And I want to tell the Honourable Member, anytime he wants to pitch in and help, we'd be more than happy to have his help.
The Honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker. I'm sure the Premier is familiar with the figures that we released earlier this week about increases in patients without a family doctor coming to emergency rooms around the province. From 2013 to 2018, the number of such visits has more than doubled at the QE2, in Amherst, in New Glasgow, in Bridgewater, in Sydney. And then in Kentville and in Truro and at the Dartmouth General, the number of such visits over that period has more than increased threefold. All told, since this government came to power, visits to emergency departments by patients without a family doctor have increased by 112%. So I want to ask the Premier whether he is, as many others are, alarmed and troubled by these numbers.
The Honourable Premier.
Mr. Speaker, I thank the Honourable for the question. Mr. Speaker, as we continue, as I said to his colleague beforehand, Mr. Speaker, we continue to work with our health care providers to ensure that they have access to primary health care teams across the province. We're investing heavily in infrastructure that has been ignored, Mr. Speaker, for decades. Our health care providers are excited about the opportunity to work in new infrastructure. We're the first province to continue to bring in an immigration stream, Mr. Speaker, specifically around health care, leading the country when it comes to that. We've had success, Mr. Speaker, when it comes to recruiting more physicians, but we also recognize, Mr. Speaker, the delivery of health care in this province will be a collaborative approach where we need nurse practitioners, family practice nurses. You've heard me say many times in some communities a social worker will be part of that team, and then continue to make sure how do we not only provide access to primary health care, but then how do we support those emergency teams across our province, Mr. Speaker, that are looking for a new model of delivering services to our citizens.
The Honourable Leader of the New Democratic Party on his first supplementary.
A woman named Tiffany McLeod who lives in Port Medway has a 12-year-old son who needs regular prescriptions and specialist referrals because of a chronic condition. And last year, they lost their family doctor. And the result is that now they're spending 5 to 10 hours every month in the emergency room in order that he will be able to access these prescriptions and these referrals. They don't want to be adding to emergency room overcrowding, but they don't have any choice. So I want to ask the Premier, as his government is now in the 7th calendar year of their record, what does he have to say to people like Tiffany McLeod?
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable Member for the question. Tiffany and many Nova Scotians, Mr. Speaker, had fallen into the situation, Mr. Speaker, where a decade or more ago, successive governments would not transition the healthcare system into the new delivery model as required. We are challenged, Mr. Speaker, as you would know, and we're trying to support Tiffany and others like her in communities. We've seen support in our community hospitals. There will be innovative ways to how do we support those communities to be able to provide access to primary health care as close to home so that they will require either, as he referred to in his, a subscription renewed or access to a specialist. They'll be able to receive that in a timely manner, Mr. Speaker. The issue that you described that Tiffany and her family are experiencing is not where we want to be. We continue to work at how we can do innovative ways in a time that not only is it in Nova Scotia, but indeed nationally when it comes to accessing primary health care is a challenge. But we know we'll continue to work with her because what you bring to the floor is a real issue for a Nova Scotia family, and it is on our mind to continue how can we find innovative ways to continue to address those issues.
The Honourable Leader of the New Democratic Party.
Thank you. Our party has pressed the government this week to make the number of visits to emergency departments by people without family doctors publicly available without anyone having to file through Freedom of Information. We've also asked that similarly publicly available would be information about how long it's taking to transfer patients from the care of paramedics to the care of emergency rooms and how long it's taking for patients to be seen in emergency rooms. The NSHA has said that they are willing to publish this information, and so I want to ask the Premier, will he ensure that this information is publicly available by the 1st of April?
The Honourable Premier.
Thank you, Mr. Speaker. I think the Honourable Member tabled a bill, I heard he was tabling a bill related to this issue. I want to tell him I take that at first blush we'll have a look at what's happening. As he would know, when we first came into government, Mr. Speaker, we looked at wait times. We began to break down the information in and around wait times, specific surgeries, physician wait times, where was shorter wait times across the province in different hospitals, all of the things that we believe is important that Nova Scotians should know when they're trying to access primary health care. We continue to make that information available. The idea that he's bringing forward is one that we will look at. I'm not sure it requires legislation, Mr. Speaker, but I do. The idea that he's brought forward is one that we will look at as we go forward.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. Our economy in this province is fragile, and our fishing industry is important to our economy. Our forestry industry is important to our economy. All sectors of our economy are very important to making Nova Scotia run. And we do need to grow the economy in this province, and we need to acknowledge the importance of our forestry industry. In 2015, our forestry industry was $2 billion of our economy. It's very, very significant to our economy in this province. So I would like to ask the Premier, does he realize the importance of our forestry industry to our economy, and when did he realize? Because it seems like he doesn't realize how important it is to our economy.
The Honourable Premier.
Mr. Speaker, it's nice to hear the Honourable Member talk about the economy, Mr. Speaker. I'm very proud of our record when it comes to economic growth in the province, Mr. Speaker. Unemployment rate is at an all-time high, Mr. Speaker. We've received the highest credit rating in the history of this province, Mr. Speaker. The Minister of Finance today gave ample notice that on the 26th of this month we'll be delivering our fourth balanced budget, Mr. Speaker. You would also know, Mr. Speaker, he talked about the resource sector. We've continued to see growth in our exports and our seafood product, Mr. Speaker, where we're getting an all-time high in prices. That's happening in spinning off in rural coastal communities, Mr. Speaker. Those are all positive signs of an economy growing. He would know we were only one of 3 Canadian provinces, and we led the way to get the exclusion around softwood lumber, because we know how important the forest sector is in this province, Mr. Speaker. It's why we continue to work with that industry to diversify, Mr. Speaker. I'm hoping, Mr. Speaker, that we continue to find a solution to ensure that Northern Pulp is operating in the future. I see the Honourable Member table the bill. It's almost like he gave up on Northern Pulp, Mr. Speaker. We think we can do both, Mr. Speaker, protect the environment at the same time ensuring that mill there providing jobs.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. The lowest projected growth in the country. The highest child poverty rates. Somebody's given up on this province, Mr. Speaker, but it's not me. I would like to ask the Premier, given the importance of the forestry industry to this province, can he say, what message does he have to forestry workers? Does he feel that they feel supported by this government for the last 4 years?
The Honourable Premier.
Forestry sector across this province continue to work with us, Mr. Speaker, when it comes to the Leahy report, laying out a long-term futuristic look at our province, Mr. Speaker. We continue to work with the mill in the Strait area to ensure that we continue to provide high-quality product. We continue to work with the entire sector, Mr. Speaker, to get an exclusion in the United States. Mr. Speaker, they stand up and say they were supported by this government. The challenge is, Mr. Speaker, we're in a community when it looks at Northern Pulp. The reality of it is, Mr. Speaker, successive governments have ignored the issue of the environmental racism that has taken place in and around Pictou Landing. Mr. Speaker, we took 5 years and gave plenty of notice, Mr. Speaker. I see at the front bench there are 3 Pictou MLAs. They've been silent in this journey. It's about time they stand up and decide whether they want the mill to be here or they want the mill to close, Mr. Speaker. We're looking for solutions to move this forward to ensure that the forestry sector is there.
The Honourable Leader of the New Democratic Party.
Thank you, Mr. Speaker. My colleague, the Conservative leader, is right when he points out that Statistics Canada this week has reported that here in Nova Scotia we have the worst child poverty of any province. But what he has said is in fact incomplete. The situation is, in fact, quite a bit darker than that. Not only are we 10th out of 10 in all the provinces, it is also the case, it has been reported this week, that 9 of those provinces are improving their position on child poverty. Only 1 of the provinces is going backwards on this subject, and that is ours. And so I want to ask the Premier, does he agree with me that these figures on child poverty released in the last few days by Statistics Canada stand as a gross indictment of his government's record?
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable Member for the question. Mr. Speaker, we too saw the stats that you're referring to. We've seen, Mr. Speaker, that in Nova Scotia, the rate around poverty is declining amongst our seniors, Mr. Speaker. We've seen the rate of poverty in those same stats are declining in and around single-parent families, Mr. Speaker. We are also troubled by the stats, Mr. Speaker. We've asked Stats Canada to demonstrate where they came up with those numbers, quite simply, because, Mr. Speaker, we've continued to invest year after year in ensuring whether it's rent supplements to help low-income Nova Scotians. The largest single increase in income assistance, Mr. Speaker, happened under our government. We continue to make investments in low-income housing, Mr. Speaker, but we too are troubled and share his concern. We're going to continue to work and find ways to ensure that we support the most vulnerable in our province, Mr. Speaker. It is why when we had an opportunity after getting back to balance, after this province had been run through successive deficit governments, the first tax cut we gave was, Mr. Speaker, was to the vulnerable Nova Scotians when we issued, Mr. Speaker, around the basic personal exemption, and low-income Nova Scotians, Mr. Speaker, received the biggest benefit of that.
Honourable Leader of the New Democratic Party.
Mr. Speaker, the Premier wants to have an inquiry as to why we are the one province in this category. I can answer the inquiry: because we have the lowest minimum wage in Canada, because at a time when we have 20% of our people paying over 50% of their income in rent, we have no rent control, because we, in social assistance, over 6 years, increased the income assistance rates only by a total of $20. That's the formula for being the only province that's in the tank on solving child poverty. That's how they did it. And furthermore, last week, we read that our Premier in Nova Scotia has the highest salary top-up of any Premier in the country, while this week we read that from Statistics Canada that the median income of the people of Nova Scotia is the lowest in the entire country. And so I do want to ask the Premier, does he not think that at some foundational level something is out of sync and out of whack when he's at the very top, while his government's decisions keep so many people at the very bottom?
The Honourable Premier.
Mr. Speaker, again, I want to thank the honourable member for the question, Mr. Speaker. The reality of it is, Mr. Speaker, we've seen more people joining the workforce, Mr. Speaker, in successive years. We've seen more young people choose to live in Nova Scotia than leave, Mr. Speaker. We've continued to see the financial picture of our province improve, Mr. Speaker. Not only is it being recognized here, it's being recognized nationally, Mr. Speaker. To continue the work that we're doing in transformation and income assistance, Mr. Speaker. What we know doesn't work, Mr. Speaker. What we know doesn't work is what the NDP did, Mr. Speaker, was ignore every problem, write a check for everything they could find, and find no solutions to the things that were impacting families at home, Mr. Speaker. It's why we've continued to improve, Mr. Speaker, to make sure that we continue to invest when we have an opportunity. Those citizens in this province, that they stood in this House, Mr. Speaker, they stood in this House when we tried to ensure that those of us who are doing okay, Mr. Speaker, slowed down the wage growth so we can invest in vulnerable Nova Scotians. They voted against it. I hear one of the honourable members talking about my own salary, Mr. Speaker. I want to tell her it was set by a Conservative Premier and it was reinforced by a New Democratic Premier, and I have not changed the salary of my job in 7 years.
The honourable member for Pictou West.
Thank you, Mr. Speaker. I hope the Premier is okay. He found a seat. My question through you, Mr. Speaker, is for the Minister of Health. In recent months, Dr. Jeannie McGilvery was forced to resign from St. Martha's Regional after pleading with the Nova Scotia Health Authority for better working conditions. Dr. McGilvery made a simple request to help avoid burnout and keep her here in Nova Scotia, the province that she loves. We still don't know why the NSHA pushed her out, and my attempts to get answers in the matter have been repeatedly rebuffed by the members opposite. So I want to ask the Minister, does the Minister agree that having Dr. McGilvery come forward in a public discussion around the physician working conditions would help us begin collectively to solve these health care crises? The
Honourable Minister of Health.
Thank you, Mr. Speaker. I think first and foremost, I think the details that the member suggests she'd been looking for around the specific situation, I hope she appreciates, does really delve into an individual person's workplace, work environment, which is generally, for privacy reasons, not discussed, and certainly not discussed in a public forum. But, Mr. Speaker, as it gets to the heart of the matter, I think the member's trying to delve into in a broader context. Certainly the recruitment, the retention and the support for physicians and indeed all of our healthcare workers is one of the many important priorities of our health authority and this government.
The honourable member for Pickering West.
Thank you very much. Dr. McGilvery is willing to come forward. She wants to come to the various committees, PAC, the Health Committee, but this government keeps turning down our request to have her. She wants to go public. Dr. McGilvery is loved in her community. She's a valuable, valuable member of the medical community, and we need her. She is not alone in expressing the burnout and anxiety over the mismanagement that this Liberal government has created in our healthcare system. We have witnessed a sustained effort by the members opposite to prevent her full story from being aired public. So I'll ask the minister, is it true or false that the minister asked government members on the Healthcare Committee to block Dr. McGilvery's testimony because it would effectively force the minister to respond to this matter publicly?
The Honourable Minister of Health.
Thank you, Mr. Speaker. That's false, Mr. Speaker. As a minister, I'm not a member of that committee. The committee, Mr. Speaker.
The Honourable Minister of Health has the floor.
Thank you, Mr. Speaker. I'm not a member on that particular committee, and so, Mr. Speaker, I'm not involved in the deliberations and the work of that committee at all.
The honourable member for Dartmouth East.
Thank you, Mr. Speaker. My question is for the Minister of Health. On February 12th, Nova Scotia paramedics said that nothing has changed after 1 year of their Code Critical campaign. Terry Chapman of the International Union of Operating Engineers indicated that the minister has failed to convene a full meeting of all stakeholders to begin to address this issue. The minister contends, Mr. Speaker, he feels the pain and pledges something will be done about the critical state of ambulance offload and response times right across the province, and I'll table that, Mr. Speaker. Clearly, that's not happening quickly enough. So I'll ask the minister, when will he do something about the catastrophic situation with ambulatory care instead of simply talking about it? Thank you, Mr. Speaker.
Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for the question. Indeed, work has begun in taking steps to improve the ambulance offload times. As I mentioned in the fall session when we had this discussion, Mr. Speaker, Dartmouth General here in the HRM Central Zone implemented a model of transition to support and expedite the transition from paramedic to hospital care. We've seen very positive results over the course of the year. That's a model that's now being implemented at the Valley Regional, and we're looking at other hospitals that can benefit from that as well. Mr. Speaker, we continue to work with our partners in the Health Authority and EMCI for the EHS system to find more improvements as well.
The honourable member for Dartmouth East.
Speaker, between November 2018 and January 31st of this year, there were more than 900 instances of ambulances being partially staffed or out of service. Now, EHS contends that 90% of the time, Mr. Speaker, their response time is less than 9 minutes. But Mr. Chapman indicated that in one recent event, 3 critically injured HRM patients waited well beyond this target time. They were in mortal danger, and the response time recorded were 28 minutes, 37 minutes, and 48 minutes, Mr. Speaker, and I'll table that. The ambulance station was only 7 minutes away. The only word that comes to mind is disgraceful. Will the Minister of Health commit today to making sure that a critically injured Nova Scotian will not have to wait 48 minutes for an ambulance? Thank you, Mr. Speaker.
The Honourable Minister of Health.
Thank you, Mr. Speaker. I want to assure the member opposite the importance of our ambulance system. It's been just over 25 years since the modernization of our ambulance services began. This work continues. We've initiated a review of that system, Mr. Speaker. Look forward to getting that report later this spring, which has assessed exactly what's going on in our EHS, our ambulance system, to provide recommendations and advice how to continue to make improvements. We continue to work with our partners in the Health Authority and the hospital to help support our EHS system. What we do know is we have to improve those times for the transition from the paramedic ambulance to transition that care into the healthcare providers within the hospital system, and that work is actively underway.
The honourable member for Kings North.
Thank you, Mr. Speaker. My question is for the Minister of Health. Mr. Speaker, as of February 5th, the supply of flu vaccines literally dried up across Nova Scotia just at the peak of flu season. The Bedford Scotia Mid Walk-in Clinic only found out about this crippling shortage after attempting to order 100 doses late in January, and I'll table that. I'm confident the Minister will agree flu vaccines are a critical piece of prevention that keeps our already overwhelmed healthcare system from further stress. And many were unaware that they would not be able to receive a flu shot until it was much too late. My question for the Minister is, does he think he did a sufficient job in informing Nova Scotians of the rapid usage rate of flu vaccines this season?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I think what's important to note for the member opposite and indeed all Nova Scotians, when we notified about the flu shot availability, the flu vaccine, Mr. Speaker, what that was referring to was the product that was ordered by the province and then distributed out. That was indicating that we had distributed our supply out to the providers who would actually provide the flu shot to other Nova Scotians. That was not, Mr. Speaker, an indication that there was no flu shots available in the province. So I think that's very important to note. I think what is important is that the work of the province and our public health officials to encourage Nova Scotians to get their flu shot. We've seen an uptick. We take the data from each year. That helps inform the order that we put in for the next year, Mr. Speaker.
The Honourable Member for Kings North.
Thank you, Mr. Speaker. We see reports that this is the earliest a shortage of flu vaccines has ever hit Nova Scotia, and the Minister is no doubt aware that between January 20th and 26th, 4 Nova Scotians died from the flu, 14 adults and 1 child required treatment at ICUs. The province's chief medical officer felt the situation was bad enough to issue a plea for providers to prioritize vaccinations for the very young only. This is another unnecessary symptom of a mismanaged healthcare system in crisis. My question for the Minister is, what lessons has the Minister learned from this mess, and what steps will he take to improve the supply of flu vaccines next year?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I think the questions reflect more on the member's understanding and appreciation of the complexity of managing the flu. Mr. Speaker, the complexity of managing the flu vaccine. The challenges here, Mr. Speaker, is in the development. You can only order once in the year, Mr. Speaker, for this product because it takes so long to actually produce the vaccines. You have to anticipate, or health officials look at strains and try to anticipate what type of flu strain is actually going to come to the province. So they have to anticipate that, not knowing. They then have to predict how many Nova Scotians are actually going to come out to receive that vaccination, Mr. Speaker. We do that using historical data and information as best we can. We ordered the appropriate amount of vaccine based upon the best data that our clinicians had available. They distributed that throughout the province. I'm very pleased to see Nova Scotians went out looking for the vaccine, and we're going to look forward to ordering more for the coming year, Mr. Speaker, so that more Nova Scotians, hopefully next year, will take their flu shots in the fall.
The Honourable Member for Cape Breton Centre.
Mr. Speaker, my question is for the Minister of Labour. Firefighting is a dangerous work. Firefighters risk their lives in emergency situations on a regular basis. But the danger doesn't end when they leave the site of the fire. Fires are more toxic now than they have ever been before. According to a recent study by the National Institute for Occupational Health and Safety, firefighters have a significantly higher incidence of cancer than the general public, regardless of their race or gender. Mr. Speaker, does the Minister agree that this situation constitutes an occupational health and safety crisis for the firefighting profession?
The Honourable Minister of Labour.
Mr. Speaker, I'd like to thank the member for the question. I'd like to thank all our firefighters and first responders for the tremendous work they do every day on behalf of Nova Scotians. Mr. Speaker, this is actually an aspect of the workers' compensation that we're actually looking at as a government, because it has been brought to my attention that other provinces have more robust and other provinces have less robust programs in place for our firefighters. So I have asked workers' compensation to actually do a jurisdictional scan across the country, bring that information back to me, and look at what cancer coverages we do have for our firefighters. I will add, Mr. Speaker, as well, included in our firefighters, I'm actually asked Workers' Compensation Board to also look at our volunteer firefighters, because they're exposed to the same risks in terms of cancer, in terms of even PTSD. And I've also am looking into extending our PTSD coverage to that group because they deserve it. Thank you, Mr. Speaker.
The honourable member for Cape Breton Centre.
Mr. Speaker, Nova Scotia was a leader on this issue in the early 2000s. We were one of the first provinces to implement presumptive coverage for firefighters. We are now at the back of the pack compared to other provinces. Our legislation has not been changed for 15 years. Firefighters in Nova Scotia have been calling on this government to update the list of cancers firefighters have presumptive coverage for, and I'll table that list of updates that they are seeking. Mr. Speaker, will the minister commit to updating the Workers' Compensation Act to expand presumptive coverage for all cancers related to firefighting for both paid and volunteer?
The Honourable Minister of Labour.
And Mr. Speaker, once again, I will repeat that this was brought to my attention, and when it was, I engaged with Workers' Compensation Board to give me a jurisdictional scan to tell me what our options are. And Mr. Speaker, that work is underway, and when that work comes to me, there could be changes to what presumptive coverages there are. But Mr. Speaker, I don't have that information. Workers' Compensation is bringing it to me, and Mr. Speaker, when it comes to me, our government will look at it. Thank you.
The honourable member for Queens Shelburne.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Health. Over the last few months, people have been quitting their jobs at the lab at the Scotia Regional Hospital in Bridgewater. I learned that not only were they not being replaced, but in January, microbiology was being moved from Bridgewater to Kentville. This means our regional hospital will no longer have microbiology services at all. So on top of short-staffed hospitals, overworked staff, and ERs that are closed more often than not, now services are being removed entirely from a regional hospital. My question for the minister is, why was microbiology moved out of the South Shore Regional Hospital?
The Honourable Minister of Health.
Thank you, Mr. Speaker. What I can assure the member opposite is that various lab services that are provided by the Nova Scotia Health Authority and by individuals, they work to ensure that they provide the appropriate tests for the population, that they're available in the timeframes that are needed for the clinical services being provided, and they look to do so in the most efficient way possible. Mr. Speaker, there are advances in technologies over the past number of years. As those technological advances improve, so do the ability to provide different types of tests in different ways. And Mr. Speaker, I think that's part of the decision factor that took place in that situation.
The honourable member for Queens Shelburne.
Thank you, Mr. Speaker. Mr. Speaker, it started with nurses taking blood instead of lab assistants. Then came the wave of resignations. With the removal of the department, wait times will increase as we wait for the samples to be transported by taxi to Kentville. Maybe when I make my weekly Facebook posts informing my constituents about Roseway being closed, I'll have to start adding a list of services that have been removed from our area. I'm no expert, but I don't think cutting services and making things less accessible for rural Nova Scotians is a solution our healthcare system has been looking for. My question for the minister is, will he commit to keeping the current services at the South Shore Regional and adequately staffing it?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I think the reference the member made to the drawing of blood and the services, in fact, provides better response times with point-of-care testing, Mr. Speaker, in some situations for conditions, Mr. Speaker. So, Mr. Speaker, I've been around. I've heard from healthcare professionals who, too, have had these point-of-care systems. That's the technology I was referring to, implemented, who expressed some reservations when they're being introduced into their community hospitals. But, Mr. Speaker, months afterwards, they've seen improvements there. I want to recognize Minister Fury, the Minister of Justice, my colleague, for his work, Mr. Speaker, advocating on behalf of the constituents there at the South Shore Regional Hospital, Mr. Speaker, because he continues to advocate for his constituents, as do all of my colleagues.
The minister is self-correcting there. That's a good thing. The honourable member for Cumberland South.
Not himself, but again, I do have a question for the Minister of Health. The emergency departments in Cumberland South are of primary concern to my residents. Last year, the emergency departments in the northern zone were closed for a total of nearly 6,000 hours. The North Cumberland Memorial Hospital that serves residents in eastern and northern parts of my constituency were closed for 2,200 hours. My question to the Minister, when will he have a plan to address the closures in North Cumberland Memorial Hospital?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I assure the member that we and our partners at Nova Scotia Health Authority take the care and the emergency care of Nova Scotians very seriously. Indeed, closures of emergency departments only happens when they're unable to staff adequately to provide safe care to the people through that emergency services. In fact, we've taken action, Mr. Speaker. We've changed programs. We have an emergency shift premium now, Mr. Speaker, that we've implemented. We know of 8 hospitals across the province making use of that emergency incentive premium. We have locum incentive program that we changed in the summer, Mr. Speaker. We've seen about 150 days or shifts being covered, Mr. Speaker, because of these changes. So while we're taking steps, Mr. Speaker, to improve the situation across the province.
The honourable member for Cumberland South.
Mr. Speaker, we just heard the Premier speak that there were doctors coming in droves, 56 I think last year. Maybe we can take a collection up and send them through the toll to come to Cumberland South. South Cumberland was closed for a total of 1,700 hours. Residents in Cumberland South, they're travelling to Amherst, to the Amherst Hospital for the regional in Cumberland County, which are already blowing at the seams with stretchers. Is the minister satisfied with the emergency coverage that we're receiving in all of Cumberland County?
The Honourable Minister of Health.
Thank you, Mr. Speaker. As I noted, the emergency services that are provided in communities across the province, we want to make sure that it's the appropriate quality care that Nova Scotians need. That's why, Mr. Speaker, we continue to make changes. We continue to invest in make changes to the incentive programs to fill those shifts that are hard to fill, Mr. Speaker. It's why we continue to invest in our collaborative practice to strengthen our primary care space, Mr. Speaker. We know that there are many people going to emergency departments where could be served in the community through primary care provider, Mr. Speaker. We've seen, Mr. Speaker, over 120 physicians. Actually, it's about 55 or 56 of them are family physicians, Mr. Speaker, since April of last year. So, Mr. Speaker, we are making steps, we are making strides, but there is more work to do, and we're committed to doing that work.
The honourable member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker. I know it's been a while since we've been in this House, so I'd like to start off by reminding everyone that my constituency of Cole Harbour Eastern Passage is the only one in the province without a single family doctor. 16 months ago, I requested and was approved for the funding by the Minister of Health for a nurse practitioner. Last week, I asked the Nova Scotia Health Authority CEO about the job advertisements online because that nurse practitioner position in Eastern Passage isn't one of them. My question for the Minister of Health is this: why are there 29 positions for clinical nurse practitioners posted online, but there is no posting for the position in Eastern Passage that the Minister approved 16 months ago?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I'd have to look in specifically at that one. Mr. Speaker, it's the Nova Scotia Health Authority that focuses on the recruitment. I don't see every single item, but what I can advise the member opposite is I'm aware that the position she's referring to has been posted on at least 2 occasions. I'm not sure what the current status is, if they've had candidates in the latest ones and just going through a hiring process, the interviews, or if they're reevaluating how they actually can fill if they haven't had applicants for the first couple of times when that position has been posted. What I can tell the member opposite about the region, Mr. Speaker, in Dartmouth, is that we have recruited 10 physicians, family physician doctors, to Dartmouth since April of 2018, and 2 more have accepted offers of employment that are going to start in the next 6 months. And, Mr. Speaker, I just met with 5 family physicians in Dartmouth yesterday, Mr. Speaker, who have taken somewhere in the vicinity, I think in just a few short months, upwards of 1,400 patients each off of the April month.
The honourable member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker. I had asked the Premier once before when he told us how many he had hired, how many had left, and he didn't answer me, so it's not my question, but I would love to know, of all the doctors who were hired, how many left. The previous MLA for my area campaigned on the very promise of a collaborative health centre for Cole Harbour Eastern Passage. I've tabled this before, but I'll table it once again. The flyers that were left on the doorsteps announcing a collaborative health centre and a doctor. There was an announcement planned. The community members were invited to come to that announcement, and it was cancelled at the last minute, a week before the election, to my best knowledge. And now here we are, almost 2 years after that election, no doctor, no nurse, no advertisement for the nurse practitioner, and no collaborative health centre. My question for the minister is, can he tell me why my constituents, why collaborative health centre was a priority for his government before the last election, but has ceased to be a priority since the election?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I can tell the member opposite that primary care access and service for all Nova Scotians remains a priority for this government. Mr. Speaker, that includes the support of collaborative practices, the expansion and implementation of new collaborative practices throughout the province. Mr. Speaker, to support physicians through these collaborative practices, we've hired over 120 health professionals to support physicians in communities across the province. Many of those, Mr. Speaker, I think somewhere in the vicinity of 50, around 50 of those are nurse practitioners supporting physicians. I think almost 100 of them are nurses, so it's almost a 50-50 split between family practice and nurse practitioners, and then other allied health professionals rounding out. These are supports we're providing to help improve primary care for all Nova Scotians.
The Honourable Member for Sackville-Beaverbank.
Yeah, thank you, Mr. Speaker. Mr. Speaker, 1 year ago today, I mentioned to the Minister of Health and Wellness about the retirement of a long-term family physician in Sackville who would be leaving 2,000 patients without a family physician. I asked the Minister at that time what those 2,000 residents of Sackville were supposed to do, and rather than actually answer the question, the Minister at the time replied that about the discussion about the investments that were being made in healthcare, but he never did tell me what to do with those 2,000 residents. Mr. Speaker, my office was contacted this week, and we've discovered that the community care walk-in clinic located at 159 Cobequid Road in Lower Sackville is going to be closing permanently as of April 2019. Last year, this clinic saw over 19,000 patients. Mr. Speaker, is the Minister aware of this closing, and what can he tell the residents of Sackville to give them peace of mind that this clinic will stay open?
The Honourable Minister of Health.
Thank you, Mr. Speaker. You know, as the member knows, as I just stated to his colleague's question, the access to primary care does remain a priority for this government. The member noted my response last time, and the response continues, is that we continue to work with our partners. We continue to invest in collaborative care practices. We continue to invest in incentive programs, Mr. Speaker. We see success. Last year, Mr. Speaker, about a year ago, with my colleague, the Minister of Immigration, we launched a new immigration stream for physicians, Mr. Speaker. We've seen success in that program. We've had about 25 physicians that have agreed to come to the province to provide care to Nova Scotians because of that program, Mr. Speaker. So this is just one example of the many good things we're doing to provide care to Nova Scotians.
The Honourable Member for Sackville-Beaverbank.
Yeah, thank you very much, Mr. Speaker. I'd say that these answers are kind of garbage because, you know, respectfully.
Order, please. Ask the Honourable Member for Sackville-Beaverbank to retract that statement. The Honourable Member for Sackville-Beaverbank.
I retract that. I apologize. Mr. Speaker, there are 2,000 patients currently without a doctor. I've got another clinic that's closing. It's not a temporary closure. It's a permanent one. I hear that the minister says things are getting better, talks about how things are getting better, talks about things aren't getting better. I mean, we have physicians leaving, people in hospitals. Mr. Speaker, I need the minister to clearly explain to the residents of Sackville where they're supposed to go for non-urgent medical care starting May 1st. Are they supposed to go to the ERs backed up? Are they supposed to wait in the ambulances to be seen? What are these residents supposed to do, Mr. Speaker?
The Honourable Minister of Health.
Thank you, Mr. Thank you,
Order,
Mr.
please. The Honourable Minister of Health has the floor.
Thank you, Mr. Speaker. What I want to again remind the member opposite is that with the additional physicians that have been recruited in the province, they continue to choose where they practice. As I mentioned just yesterday, I met with 4 out of 5 new physicians that have come internationally providing family care at a Dartmouth clinic, Mr. Speaker. I had a great conversation to learn about the practice and the transition here. Learning how we can do things a little bit better to help with those transitions, but very pleased to see how many patients they were able to take from retiring physicians in this province. And Mr. Speaker, as we continue our recruitment efforts, whether it's in Sackville, Mr. Speaker, or other parts of the province, we continue those recruitment efforts, and that would be the care being provided to replace retiring physicians.
The honourable member for Halifax Needham.
Mr. Speaker, my question is for the Minister of Internal Services. Yesterday at the Public Accounts Committee, we heard from Information and Privacy Commissioner Catherine Tully. Ms. Tully stated in no uncertain terms that our province's Freedom of Information and Protection of Privacy Act is obsolete. As she shared at the committee, when the law was written in 1993, there were only 130 websites in the world and Google did not exist. Mr. Speaker, will the minister commit to beginning consultations on our new Privacy Act during this session?
The Honourable Minister of Justice.
Thank you, Mr. Speaker, and I thank my colleague for the question. My colleague would know, Mr. Speaker, that there was a report prepared by the privacy officer. Most recently, Mr. Speaker, in addition to that, reviews completed by the privacy officer as well as the Auditor General. And we are presently reviewing all of that material, Mr. Speaker, and will respond appropriately.
The honourable member for Halifax Needham.
Mr. Speaker, Ms. Tully was very clear in her presentation yesterday. Unlike modern laws in other jurisdictions, our current FOIPOP law does not require the government to take action to prevent a data breach. Without updated legislation, Ms. Tully says Nova Scotians are left behind to wonder when the next breach will occur and if they will even hear about it. Thousands of records belonging to Nova Scotians were accessed through a web portal developed by the Department of Internal Services. Can the minister explain why updating privacy laws was not part of the department's action plan in response to this preventable and abject failure?
The Honourable Minister of Justice.
Thank you, Mr. Speaker. As I indicated in my earlier response, there are 3 elements, Mr. Speaker, that require extensive review. It's important that we do that, Mr. Speaker. To change legislation prior to review of the information that's been advanced would be premature.
The honourable member for Pictou West.
Thank you very much, Mr. Speaker. My question is for the Minister of Health. I am extremely concerned with the increase of Pictou West constituents who have Lyme disease. Actually, I'm very concerned for this whole province with regards to this matter. I was sad to learn recently of young mothers who have given birth to babies who were born with Lyme disease and who were given only 5 weeks of antibiotics. And that's the standard duration for treatment in Nova Scotia. But it's not sufficient. It's not sufficient to treat their conditions, and now they are traveling to Maine for prolonged and better treatment. I'd like to know, does the minister believe that it is acceptable for these young mothers and their babies who have Lyme disease to have to travel outside of their province and as well as their country to find effective treatment?
The Honourable Minister of Health.
Mr. Speaker, what I can advise the member and all members of the legislature is that indeed I do accept the clinical advice and recommendation and the standards established nationally, Mr. Speaker, which form the adoption of the standards that our public health officials have established here in the province, the clinical treatments, Mr. Speaker. I do not have, Mr. Speaker, the background to make those clinical recommendations in terms of the best form of treatment. Perhaps the member from Pictou does have the clinical expertise to do that, but Mr. Speaker, I'll defer to the physicians and the medical experts as to the best form of treatment for this and other conditions.
The honourable member for Pictou West.
Look, Mr. Speaker, we have Dr. Summers of NSHA who's going around the province contacting MLAs to make awareness about the hot spots. It's increasing in this province, and it's very concerning to all of us. I know it is. It's my understanding that the Nova Scotia follows treatment guidelines from the Infectious Disease Society of America. In Maine, physicians take advantage of the recommendations from the International Lyme and Associated Diseases Society, which promotes the use of long-term antibiotics. So my question is, will the minister commit today to begin following these guidelines so that those suffering with Lyme disease can be treated effectively and efficiently without having to pick up their babies and leave their province and their country to be treated?
The Honourable Minister of Health.
Mr. Speaker, I commit to continue to take the advice of the medical professionals here in Nova Scotia.
Time allotted for oral questions put by members has expired.